Hi, my name's Kath Helliwell and I'm Head of Commissioning for Long-Term Conditions across the two Bradford CCGs.
Hiya, my name's Colette Connolly. I'm Head of Commissioning for Self-Care and Prevention.
Hi, I'm Louise Atherton, Head of Commissioning for Urgent and Emergency Care and Substance Misuse.
Hello, I'm Matt Vaughan. I'm Head of Commissioning for Children and Young People's Mental Health and Adult Mental Health.
Hi, my name is Walter O'Neill. I'm the Head of Commissioning for Community Services in Bradford.
Hi, I'm Ruth Hayward, Head of Commissioning for Women and Children's Services, working across Bradford City, Bradford Districts and Airedale, Wharfdale and Craven.
Hi, I'm Ian Wallace. I joined the CCGs last November as Head of Commissioning for Planned Care and Cancer.
Hi, I'm Taz Aldoud. I'm a GP and Clinical Board Member leading on self-care and innovation.
Hi, I'm Mick James. I'm one of the two Mental Health Commissioners working primarily with adults and older people. I'm currently working on developing a vision for mental health in Bradford over the next 5 years. What am I most proud of? Starting with our work with adults. On average, people with severe mental health problems die 20 years younger than the rest of the population because their physical health needs are not identified and met. In Bradford, we have a scheme in which 5,000 people with serious mental health problems now receive a health check. That helps them lead longer, healthier lives. It's also great that this work has been recognised nationally and is used as an example for others to follow.
What am I most proud of? Well, it's got to be Bradford Healthy Hearts. This is a programme about educating and helping people understand about their risks of cardiovascular disease. Cardiovascular disease is heart attacks and strokes, and we want to make sure that in Bradford we reduce people's risk. What we've done to date is that we've made sure that people understand what medication is that they're taking, how it works, and making sure that they are actually taking their medication to reduce their risk of having one of these cardiovascular disease events.
Thinking about the three highlights from this year so far, the first one is the Voluntary Sector Summit that we ran in February. The aim of the summit really was to get together voluntary sector and statutory sector staff to see how we can work together better in the future really. And it was a real success. We had over 140 people there. A speaker, Lord Mawson, was fantastic, telling us how to work differently with the voluntary sector. And the end result was quite good really. We've set up a relationship group now so we can do a lot more work collaboratively and jointly, so that's great.
The things I'm most proud of in the different areas I work with this year are in substance misuse. We had a situation where I came into Bradford and there'd been a really good service review that they'd looked at what the services were like in Bradford. And there was a lot of good practice, but the services were quite fractured and there was different services for drugs and alcohol. And we had services that were set up around drug use, which is kind of on the decline, crack and heroin use, and not responding well to that newer drugs, which is like prescription-only medications, and MPSs, which were what was called legal highs. Now we've got our plans and we're out to tender with a service that's a single integrated service that will increase treatment places, reach out into the community, be based on assessed needs and have a good reach in all the different communities of Bradford.
In Children and Young People's Mental Health, through the Future in Mind Locality Transformation Plan, we've been able to improve access to early intervention for children in schools, also improving access to children and young people in mental health crisis, and developing service for eating disorders. As well as that, we've been developing therapeutic options for looked after and adopted children, and improving the skills within the children's workforce so that services can be accessed as and when required.
The thing that I'm most proud of over the last 12 months is the creation of something called the Intermediate Care Hub. Intermediate care services are those services that help a person when they need a bit of extra support but don't really need to go to hospital. Or if they're in hospital and they're medically ready for discharge but actually need a bit more help to go home, they can have extra support through the virtual ward in their own home, or they might go into a bed in a community setting provided by the local authority or by the Bradford Royal Infirmary. And it means that people spend less time in hospital, which is where people don't want to spend too much time because they're separated from the people who really love them and who care for them in their home environment.
Over the last year, working with my clinical leads and colleagues from service providers and the local authority, we've worked hard to improve the experience of women and children as they access health services. From a maternity perspective, we have improved services for women with perinatal mental health issues, including the design and implementation of training for midwives, health visitors, mental health professionals and children's centre staff. Much of the work in the children's arena has been in response to the need to improve service provision for children and young people with special educational needs and disabilities, with a particular focus on the need to improve the level of support young people receive as they move from children's to adult health services.
We've worked closely with local hospitals and GPs to improve the outpatient experience. This has included improving referral processes through more use of electronic referral and electronic consultation, and also encouraging the use of texting appointment reminders to patients. I've been able to work in a really joined up way with the hospitals so that patients can get the best out of all services. Cancer remains a priority area, and a lot of work is happening to improve the uptake of screening in the district. This year we've been concentrating on improving the way in which GPs refer patients for tests and hospital care, so that patients get the right treatment in the right place at the right time.
The thing I'm most proud of is the work that we've done with the integrated digital care record, bringing health and social care records together. We are convinced will improve patient care and help the frontline staff at the same time.
Locally, we've got high levels of diagnosis, and we want to carry on making sure that we keep those levels high so we can help people get the support that they need as quickly as possible, as this helps people live independently at home for longer.
Thinking for next year, we've got one really exciting piece of work that I'm really looking forward to around self-care hubs. This is where we're working in some of the health centres to really transform them and move them away from just being health centres, but actually more wellbeing community centres with lots more services and activities happening within them. We've also got a couple of other areas of work around developing the workforce to promote self-care and also supporting our children and young people to self-care, because we all know that's really where we need to start the work with prevention.
The thing that I'm looking forward to being involved in next year is what we call the out of hospital programme, and we're going to use a process called structured collaboration to help us work with the people who provide services, the people who use services, the patients and the service users, and everybody else involved in the health and care economy in Bradford in order to make services more efficient, really help a person's journey through services, because that can be difficult at times, moving from one service to another. And actually we hope to provide better value for money, because that's our role as commissioners, as well as providing quality services, to make sure that we can use the Bradford pound to meet the needs of all the residents of Bradford.
The focus for the coming year will be the development of our plans to implement the recommendations within the 5-year forward view for maternity services, Better Births. We will take the learning from the personalised maternity care pilot currently running within the Better Start Bradford area, along with information gathered through our annual maternity focus groups, to deliver and develop a maternity service which offers all women across Bradford personalised maternity care which meets their needs, which is delivered via a caseloading model.
So what would a good future look like, where people are empowered and have independence, have the confidence to be able to manage their own care and health and well-being? And I think that's where we have an equal conversation, information, expertise. We're transferring the skills from us, the healthcare providers, to people who have to live with their long-term conditions. If we can do that through digital means, through other ways that we can help with that, that would be a fantastic future.
In terms of next year and what we're going to be doing, well, it's more of the same. It's making sure that we get out to all our population, helping them understand what their risks are of getting cardiovascular disease. So trying to encourage people to stop smoking, take more exercise and eat a healthy diet as well. So come on, Bradford.
Yes,